Thank you so much, Stephen, and good morning, good evening, good afternoon, everybody. I'd just like to say welcome to our UDI Webinar 8 today. Before we begin, I would like to start by acknowledging the traditional custodians of the land on which we meet today. And in where I am in Canberra, it's the Ngunnawal people. And I'd also like to pay my respects to elders past and present and extend that respect to any Aboriginal and Torres Strait Islander colleagues attending our webinar today. So for our agenda today, we are absolutely delighted that we have an invited guest speaker. Roger Peterson from Arthrex is going to be talking through his experience, some of the challenges he's seen in UDI implementations globally, and a little bit of an extra focus on labelling as well today. So we're very excited that Roger has made the time available to share his experience with us today and with you. We'll do a project update in terms of where we're up to and also what's coming between now and the end of June. And then we'll have time for questions and answers at the end. So as Stephen mentioned, this is the first time we've been using Slido, and Rachel, as you know, is our normal operator, has lost our voice. So we're going to be keeping everything crossed that the technology works for us. Please bear with us if it doesn't. And if you have any questions, please let us know. If for any reason you can't get Slido or you have any concerns, you're welcome to send us questions to our email, which is udi@health.gov.au, and we'll make sure they get added in there as well. So I'd like to now introduce our special invited guest presenter, Roger Peterson. Roger is a senior manager for global labelling in the regulatory area for Arthrex. He has over 20 years experience in the industry within several roles, so crossing product development, quality assurance, operations, and regulatory operations. He joined Arthrex in 2016, and he has experience across other organisations as well as Arthrex, including Integer, Abbott, and Steris. He's an active member. I don't know how Roger gets any time to sleep or work or have a life outside. You can see he's an active member of various committees and working groups and other groups like the UDI working group, the MedTech Europe Implant Card working group. He works with the ISO Technical Committee 210, which is working group 3 that looks at graphical symbols and nomenclature, both critical to UDI. And also he's got, he's working, leading the Arthrex UDI work with global unique device identification initiative, so very much focused on the European implementation at the moment. So thank you, Roger, for making the time today. I'm very much looking forward to hearing your presentation, and we will hand over to you now.
Thank you, Michelle. All right. Well, thank you, everyone, for joining today's webinar. Basically, introduction to Arthrex Incorporated. We're headquartered in Naples, Florida, USA. Basically, Southwest Florida. We have locations globally throughout, the international community. We have a sister headquarters in Munich, Germany, as well as a central distribution logistics center in Venlo, Netherlands. And we also have a subsidiary in Sydney, Australia. We have over 19,000 product innovations within our product portfolio, all of which, helping surgeons treat their patients better within the orthopedic sports medicine space. Products including arthroplasty, distal extremities, synergy, imaging, scopic surgery system, shoulder, elbow, orthopedics, resection, knee and hip devices. We're also MedSAP, Medical Device Single Audit Program certified in the US, Australia, Canada, Brazil, Japan, all under ISO 13485 with BSI and MedSAP certifications. What is UDI and how do we use it? It's a question that's often asked by laypersons, not familiar with UDI. But I'm sure everyone on this call understands what the basics are, that being device identifier, production identifier, a corresponding unique device identification database, a means to automatically capture, automatic identification data capture, that being the barcodes, paramount to the product labeling. With Arthrex, our UDI issuing agency is GS1. The DI that we use is the global trade item number. Production identifiers, including expiry date, manufacturing date, lot, and/or serial number. Following the International Medical Device Regulators Forum, there's four primary tenets of the UDI system: assigning means to assign the device identifier, G10, our labeling containing device identifier and production identifiers, and then registering the subsequent data record, payload of UDI data attributes within a national registry. And then of course enabling this to for healthcare practitioners to scan, transact, and retain UDI information. Within the Arthrex Global UDI strategy, our UDI team reports into regulatory operations. We work with data stewards and champion the stakeholder engagement throughout the organization, which continues to grow as the need for UDI data increases. Partner heavily with master data governance to ensure data integrity and data stewardship actually is maintained via process and work instructions. We also work closely with supply chain logistics, ability to scan and transact materials. We also support our healthcare providers, both from enabling data subscriptions through GDSN in syndicating UDI data, but also in regards to transacting within their scanning technologies. And then also our in-country regulatory support, various jurisdictions such as South Korea, Australia, Saudi Arabia, where the in-country representative has or will be publishing our UDI data. And then within the global program, obviously, the USA FDA Good ID is fairly mature at this point. We are in the throes of meeting our European IMDR requirements within UDI, which is European Database of Medical Devices. Saudi Arabia, levels of compliance we've achieved thus far. South Korea, within the integrated medical device information system. And then of course, following the growing regulatory landscape within Australia and the development of the OS UDID, China, UDID, Singapore, and then following the regulation within Brazil that was published this last December. And then of course there's other jurisdictions and various levels of regulation development that we're also tracking. Within the Arthrex UDI program, product development and engineering is in essence the starting point. Creating new materials, bill of materials, all associated product attributes, part description, G10 serial, is the device sterile or not, clinically relevant size information. And then we also work closely with label development in designing the labels, required information, data manufactured if applicable, shelf life, expiry date, magnetic resonance safety information, and then subsequently publishing the data to the FDA Good ID or a jurisdictional registry or database. Supply chain, ability to manage product effectivity, material status, country of origin, and then working within the various distribution channels. Label operations is key. Managing the enterprise labeling master data within the enterprise software systems, printing correct and legible labels is paramount, and ensuring the barcode scannability and maintaining barcode quality characteristics. Manage manufacturing and operations. Obviously, there's various, depending upon if you offer reusable devices, there's direct part marking involved for packaging, labeling application, product traceability, warehouse and logistics, material transactions, enabling seamless customer order fulfillment. Of course, quality assurance and control, maintaining G10 functional name, verifying labels. And then regulatory affairs is key. Maintaining correct FDA product codes, submission files, global inclusion listings is key, as well as other regulatory data. And as far as how we provide our UDI data, our system of record is our ERP system, which is SAP, based on the various projects within our UDI program, UDIMED, for instance, where we're continuing to collect data, maybe in the form of spreadsheets, but we are moving towards populating the data within SAP. Our data publication, basically by means of a product information management system, where we publish data through the GDSN to our recipients, hospitals, distributors, FDA Good ID, outside OUS regulatory bodies, etc. Hospitals need the UDI data for transacting electronic patient health records using such systems as Epic, Cerner, etc. Some of the data challenges related or data attribute comparison within our UDI challenges. We find that there are some data fields that match identically between, for instance, like UDIMED and Good ID. There's some fields that are similar but different as far as the type of data, the enumerations, if you will. And then, of course, data fields that are new within UDIMED, single registration number, authorized representative, contact information, risk class, European risk class, additional trade names, restricted number of reuses for reusable devices, URL for additional information, critical warnings, even endocrine disrupting data related to substances that might be used either in process or within some of our devices. We found is, on average, the data attributes in scope for Arthrex, like the Good ID, we're averaging roughly 59 data attributes on average. And it cascades into 81 for our UDIMED legacy device registrations. And then we're finding now that with our UDIMED preparations for EU MDR, that cascades even more or further into 135 data attributes. And what's interesting is the data identification is step one. Step two is then harvesting the data and then populating that within our ERP system, which is our source of truth. Even once that's accomplished, then we have to build a process around maintaining that data, engaging the stakeholders and data stewards in supporting an ongoing process, which is key to the overall success of our UDI program. Some of the other things related to UDIMED, under the Medical Device Directive, our legacy devices, the key field within UDIMED, which is an UDIMED DI, has a one-to-one relationship with the UDI DI. However, that's starkly different under EMDR, where we structure multiple UDI DIs within a single basic UDI DI, which is a global model number. This illustration illustrates how we need to nest or aggregate the UDI DIs within the basic UDI DI. We're not doing that within our ERP system. However, within our product information management tool, we are planning on managing this essential relationship of UDI DI with the basic UDI DI. Another challenge is the nomenclature. Most of you are aware, the European Union adopted the European Medical Device Nomenclature, which is founded on the former Italian classification for medical devices. What's important here is the relationship of EMDN, global medical device nomenclature, ensuring that we have that same relationship within our ERP system. Manufacturers are responsible, allocating the most granular code available. Here are some examples of the EMDN codes that we've allocated for some of our devices. It's a leveled coding structure up to 7 levels within the architecture of the nomenclature. As far as consumption of UDI, changing subjects here a little bit, the UDI data carrier under certain regulations within European MDR, Annex 6, Part C 4.5, AIDC carriers other than the UDI carrier shall be readily identifiable. Same with the FDA, where the AID technology, the barcode used to convey the UDI is not evident on visual examination. The device or label package must disclose the presence of AIDC technology. And this has been a challenge within, at least the United States, having its genesis within the industry association for our healthcare practitioners and surgeons, the Association of Healthcare Resource Materials and Management or Learning UDI Community presented a work request to the ISO Committee 210 Working Group 3 to develop a graphical symbol for manufacturers to use. And this is the result of that work that was put forth over the course of several years, last 3 years basically, in developing this graphical symbol and validating it for inclusion into ISO 15223-1. That standard was published this past year in July of 2021. And then this is an example of where the UDI symbol is to be used. Typically, where a medical device may have more than one barcode being disparate from the UDI data carrier, it is recommended to deploy the UDI symbol with the UDI data carrier that only contains a UDI DI and UDI PI, leaving other barcodes in their own state. This is enables practitioners to quickly scan and transact UDI information in the surgical suite and hospital point of care locations. Another use for the UDI symbol is within the implant card. This is actually a promulgated requirement within the Medical Device Coordination Group Guidance 2019-8, where the UDI symbol is actually included with the UDI DI. And then the top right here, we see a couple of examples of where the UDI symbol is deployed with a linear, particularly a GS1 128 barcode, or a 2D data matrix barcode containing the same attributes. So within the US, Centers for Medicare and Medicaid Services, as far as reimbursement activities are concerned, or open payments, there's actually a regulation now where our healthcare practitioners are required to capture the UDI DI for purposes of reimbursement. And this is critical in the sense that they need this information quickly and they need it to be reliable. In essence, the UDI system as a whole is, it starts with the manufacturer's allocation of the UDI DI, and then subsequently publishing the data to a UDI database. But it's critical because the practitioners, they're relying on the barcode quality and able to scan and transact that UDI DI, UDI PI, but also being able to transact against what was published in a UDI database such as GoodID or other jurisdictional UDI database. As far as the future of UDI, at least within the US, we have NEST, which is the National Evaluation System for Healthcare Technology Coordination Center, partnering with the FDA Center for Devices and Radiological Health, has its foundations on UDI. And it's basically a voluntary data ecosystem consolidating real world evidence from the various registries, clinical registries, even electronic patient health records, medical billing, reimbursements, patient-mediated data, and material logistics. Reason being is that when collected and used effectively, real-world evidence can actually benefit all the stakeholders within the NEST ecosystem by empowering patients, accelerating medical device innovation, and overall improvement of healthcare outcomes. That's it as far as what I have for tonight.
Thank you so much, Roger. Really appreciate that. And we'll come back with some questions and answers at the end. If you have questions specifically for Roger, please put them into Slido. In terms of the update from a UDI perspective and where we're up to, we'll just move forward. Thank you. So we've been doing some work to successfully, or we have now successfully connected the Australian version of the National Product Catalogue, which is the Australian equivalent of the Global Data Synchronization Network that Roger mentioned. We've managed to connect that to our Sandpit version of the Australian UDI database. So we've been doing some testing on that, and we've successfully passed data into our UDI database through the NPC. So that's a very big step forward for us. We also are looking at aligning the data between the ARTG, the Australian Register of Therapeutic Goods, and the UDI. So there are a number of data fields, for example, that will be in both the Global Medical Device Nomenclature and perhaps clinical relevant size, method of sterilization, whether the product is supplied sterile. So we need to look across both of those data sets now and work out how that will fit and how those two data sets will align. We've also established a technical working group, so really to look at the ICT components of the data interoperability. So for providers of data, how does the data come from those systems into the UDI? And then for the users of the data from hospitals, healthcare registries, for consumers, for looking up their device that might be on their patient implant card, to actually learn some more about what's being used and prioritize the formats particularly that we use to support those. We have split that group into two now. So we have a providers of data group and a users of data group, and then once a month we come back together and we share the learnings from both of those groups, and we have presentations. So if you're not already on those and you'd like to be included, please email us at udi@health.gov.au, because it's a really important forum for sharing information, but also to inform us on what's being used, which formats are being used to assist us in our design and build work. Just sharing this slide again for anyone who hasn't perhaps seen it. So our Australian timing is that we are planning to make our sandpit version of the UDI database available in June. And that is really to assist to get some feedback early on usability, on how easy it is to connect to, whether there's things we need to adjust to make it more useful and more usable ahead of voluntary compliance in January 2023. So it will be only voluntary, it will be for high-risk devices, but really that next 6 months and the use of the sandpit is to help inform us so that when we go live in January, we've already got that feedback around usability. What that also means is in June this year, we'll have a third consultation paper, and that will be very much focused on the regulatory framework to allow us to be informed when we put our advice up to government in terms of the regulatory framework for UDI in anticipation of that January start. And then we need to still work through what the transition looks like in Australia, given we know other countries have gone by risk class. We've also had feedback that we could go faster, so we need to look at both of those, and that will be part of our regulatory consultation in June. So really appreciate any input to the regulations through that consultation paper, and we'll provide more information about that. A little bit more about that technical working group. So we've got some themes that have emerged as part of the discussions there. You heard Roger and many of our other guest presenters from manufacturers talk about the challenge of managing the data elements, so that we have that emerging theme of minimizing anything additional for Australia, to make the definitions clear to avoid any confusion so everyone's aware of what a particular data item is meant to mean. The ability to allow changes to data, so we know, particularly from the US implementation, that there are reasons for changing data, and it should be easy to do that. We've looked at some of the formats and the preferences around the formats for machine-to-machine data upload, including HL7 SBL and FHIR, FHIR. We also heard to base initial considerations on the US FDA UDI implementation. Need support for automated versioning of records. So that's the ability to see what has happened over time, how the data relating to a device has changed, and see what those changes are. Also, very strong feedback every time we consult on the importance of a help desk for support, the ability for us to provide those mechanisms to allow that support. And the relationship between catalogue number and UDI, they're discussions that are ongoing from a provider working group perspective. Just a reminder in terms of what's in the sandpit. So ideally, we've broken it down into the 4 key user groups. Sponsors and manufacturers be focused on how do I get my data into the system, how easy is it, which data elements, how might I make changes or delete those, how might I attach a document or a URL to a product information, for example. And then also when we look at that alignment and integrity with the UDI, and the Australian Register of Therapeutic Goods, what needs to happen as part of that work. From an early adopters perspective, so we have an early adopter project based in Queensland with Queensland Health at the moment. Really, how do they get access to the data? How might they download it? How might they see the changes over time from a registry perspective, for example? The scanning, so the ability to actually scan and then look up that device information on labels and through barcodes and other symbologies. And then the device data. So we've downloaded quite a bit of US data out of the Good ID to support some of those projects and for Queensland particularly at the moment. From a public user, so as a consumer or as a theatre nurse or anyone who might want to look up or download data, how would they do that? How would the scanning work and what access do they need for downloads, for example, using the comma separated values, because it's the most common in terms of that use. And then the Therapeutic Goods Administration. So there's work that the TGA needs to do around UDI as well. They'll need to manage reference data sets. They'll need to look at operational statistics. We'll have to manage releases and reference data and do the data integrity and validation checking as well. So all of those 4 groups of users will have access to the sandpit from June, July, then to look and test and see what works, including the portal. So it's not just a machine to machine, it's through our web portal or use on a phone or a laptop or a device as well. So some more specifics, and we plan in our June webinar to provide more information as well. So we'll have an onboarding process, so we'll need to provide separate logons because this isn't a production environment. We'll need to manage user logons and provide those. We'll have the dedicated help desk support, so we're in the process of getting that ready now, and that will be available for sandpit use as well. We'll put some guidance together, some user guides on how to use the portal, for example, how to connect to provide data via a machine-to-machine interface. And then, as I mentioned, we'll have some more specifics at the June webinar. If there's anyone if you're interested in becoming part of that sandpit group, please email us at udi@health.gov.au. We'd really love to hear from you and what your planning might be in terms of when you might like to use it. Looking ahead to our next webinars, so our webinars are generally the 3rd Tuesday of every month at this time. Next month, delighted to let you know we have 2 invited guest speakers, a software organisation that incorporates UDI in clinical and other systems, and a speaker from a US hospital who's using UDI for products as part of the hospital process. So really starting to hear from that use perspective in our May webinar. So we're very much looking forward to that. And then in June will be more information about the sandpit, about getting access, what's in there. And the other thing in June that is part of that regulatory consultation we'll be doing using the new Consultation Hub tool. We will also provide information on that probably in the June webinar, depending on the timing. But really, we're going to focus on how it might work in Australia, the impacts of accepting both US and EU labels and data, what the transition might look like in Australia, and also what the regulatory framework needs to look like. So more detail on that to come. We need that in place by the 1st of January for our voluntary compliance. I'll stop there. So thank you very much for listening. We will do a quick 5 minutes of live poll. Appreciate your feedback on how the webinar went, how useful it was for you, what we might do differently next time if you've got any ideas about future speakers. And we'll start to look over the Slido questions. I see they've been coming in, and we'll come back in about 5 minutes and we'll start to answer some of those, and I'll read them out and direct them to either Roger or back to myself as part of that process. So we'll see you just in a few minutes. Thank you. Hi, everybody. Welcome back. In terms of some of those questions and answers, we have a couple that haven't come through Slido. They were either pre-questions or they've come through the Q&A or the chat. So I'm happy to kick off on those. So we had a question on the timing for the project plan for the integration between ARTG and UDI and how that's going to work. So I'll just talk about that briefly now. So we're at the point where we have a project plan that is going through final internal approval. And the plan is that between now and June, we'll undertake some analysis to understand what the common data elements are and what the quality of the data is in the Register of Therapeutic Goods already, and then what we might do where we need to go back to sponsors, for example, to get clarity on the data or make changes to the data if necessary, and how we align that with the UDI going forward. So it's something that I expect in sort of July, August will come out with a more consolidated view of conceptually how the two will work. We understand we get lots of questions, particularly through the technical working groups around the integration between the two and the processes. And so they're things that we are working on and we will be working on as part of that project. So I expect by July we should have a good idea of what that looks like and be able to come back perhaps in our July webinar with some more information, but appreciate the support there. The focus will be on the UDI integration areas, and so GMDN will be one, for example, supplied sterile, those areas that we know are across both. So hopefully that answers the question, and we will provide more information as we go. I've got a question for you, Robert, if that is okay. And I'm happy to chip in if need be. But we have a question about, do you have any recommendations for Australian companies? We have a lot of Australian companies on the webinars who perhaps don't have had to do this for the US or the EU, for example. And do you have any recommendations for them on how they might prepare for the implementation of UDI in Australia?
Sure. Yeah, the first thing that comes to mind is, their market access. Are they a global organization, even though that they're in Australia? If it's solely Australia, a thorough understanding of the IMDRF UDI requirements and building, a program around, the collection of the data relevant, to UDI. But if they are indeed, a global organization, do you label flow and market? That being said, is the labeling supportive of an international market is a consideration, because it also relates to uniqueness of the registration within one jurisdiction to another. For instance, in South Korea, a UDI DI could, or an allocation rule could change based on your registration. Something as simple as changing a distinct manufacturer location could trigger a registration, which requires a new UDI DI. And so that is unique to one jurisdiction. But within Australia, a thorough understanding of the IMDRF UDI requirements would be a starting point. And then, of course, following the progression of the development of the OS UDID, this forum, and the forthcoming regulation.
Thank you so much, Roger. That's really helpful. And I've got another one for you as well. Are you happy to share what you think the critical issues might be that regulatory authorities need to consider that impact the harmonization? So, you did the comparison across the data elements, for example. or that impact multinational companies the greatest? Are you able to share your thinking on those?
Oh, sure. Yeah, again, it's the harmonization is critical of, the core, product model of UDI attributes from one jurisdiction to the next is key. Where the challenges are is where you have the uniqueness, where an allocation, UDI, DI, be it a G10 allocation rule could trigger a unique UDI, DI. Whereas 90% of your market might be fine under a particular UDI, DI. Having one jurisdiction rule take precedent. There has to be a thorough understanding of how you manage multiple UDI, DIs in that instance. In essence, very specific to market access. That would be one consideration. And then, of course, building your program. UDI is not a project. It's definitely a program, which is a family of projects nested within that, because each jurisdiction globally is going to have uniqueness within their program as far as what the requirements are. When data is submitted, the versioning of data is critical as well, because that will differ from one jurisdiction to another.
Thank you. That's very helpful. And if there's any others you might want to provide later, we'd be happy to share those as well if you have any other thinkings. We have a question around will the UDI replace the GMDN code? And I'm happy to take that one. And the answer is every UDI record will still require a GMDN code. That the GMDN code is a piece of data for that device, but it won't. The UDI won't replace it. We have a question on who issues the UDI and who's responsible for ensuring it's in the label, the manufacturer or the sponsor. And I'll take that one because we have a slightly different model in Australia. But the general rule is that the issuing agencies are responsible for the formats of the UDI. So globally, they're generally GS1, HEBIC, and ICBA. The three of those are generally common throughout all of the jurisdictions. But the manufacturer is primarily responsible for then assigning the UDI and labelling. In Australia, we have a sponsor who is legally responsible for the device in Australia, but the labeler is generally responsible for the UDI. We have two questions around the global data synchronization network around how do sponsors use it to push data through to customers and then also through to regulators, and whether that's double work. And the second one is, in other countries, can the UDI regulators push to the GS1, GDSN supply chain customer portals instead of reverse? The second one, I can't answer. It is a very interesting question, and we might go and do some more investigation on that one. But on the first one, the anticipation is it would be the same mechanisms for data to go through to purchasers, for example, or hospitals, as to the UDI. It is something we're working through. It shouldn't be double work, but we're just in the moment now. Now we've got our connection up and running into our sandpit. We'll start to work out a little bit more what that might look like should we connect in our production version going forward. Another question is, what will the maintenance costs or annual fees be for subscription to Australian UDID database for manufacturers and sponsors? It's a good question. It is something that we don't yet have an answer on, but we will need to. So for our project or program of UDI implementation, we did receive specific funding for the establishment, but UDI will need to be included in fees and charges going forward. And so there will be future regulatory engagement on what that looks like and what those costs might be for users of the data. So anyone who wants to download the data as a public user, there's no charge for that data access. So it will be available free of charge for viewing through the portal or for download, including machine-to-machine download as well. Another question around the integration or the work that's going to look at the data held in the ARTG and UDI databases, and how to, will there be a plan to link them so that the manufacturers and sponsors won't need to populate them? It's a really good question, and it is something we are looking at, how we can link the data from one to the other. How we can validate it if it's different, or whether we might start to auto-populate in the future. So a lot of that work we anticipate will come through the TGA transformation, which is looking at broader systems outside the UDI and how that might work going forward, because a lot of our existing systems, including the ARTG, are older and are more difficult to change. And so, but it's a good question, and we will definitely be looking at that. Hopefully we'll get some more questions for Roger, but I've got another one, which is a TGA question. So we have a question on, is there consideration of having an ARTG unlock facility, as in the FDA Good ID, to unlock critical protected fields? It's a good question. So I can't answer that for the ARTG, but from a UDI perspective, part of the work we're doing with the technical working groups is to understand which data might change, how regular it might change. So we've got feedback, for example, that in some cases a manufacturer might accidentally make an error in the data and they might not discover that for 2 years. And so having a short unlock time frame is helpful in some ways, but there are definitely going to be scenarios later on where you do need that data for. And Roger talked about, for example, for triggers, when a UDI-DI changes in another country, say the EU, what does that mean for data that's provided to Australia, and would locking make that difficult, for example? So really looking at that as part of that technical working group, and also we can consider putting it in the consultation as well. But if you have advice or thoughts or insight into that, be great to join one of the technical working groups or send us an email. It would be very, very helpful. I think I've just about got to the end of the questions. So are there any more for Roger before we sign off? No, I've got another question around expected compliance requirements for different types of devices, such as surgical instruments, kits, and comparison to the US Good ID and EMDRF. So it's something that we'll be looking at as part of our regulatory framework and consulting on in June, is really to look at UDI for those specific device types. And in some cases, there are definitions that don't quite align between the IMDRF, the US, the EU, and Australia, for example. So we'll need to look at how those comparisons work and what we'll need for Australia. So, all right, we'll give everybody 4 minutes back. Roger, thank you again so much for joining us today, answering the questions and providing your insights. We really appreciate you making the time. It was very helpful.
Thank you, Michelle.
Thank you, everybody. Have a good Tuesday.